Jordan, up next day. So I'm going to be taking a couple shots of your chest today.
Sounds good.
Okay, first off, can I verify your full name and date of birth?
Chris Stater, birthday is 6/25/76.
Okay. And let's do the burn. Why are you visiting us today, Chris?
Having trouble swallowing.
Oh, really? And that's very interesting. Was this acute? Did this just come on, or has it been
About a week ago.
About a week ago, huh? You having any trouble breathing, anything like that?
No, not all the time.
Okay, all right. You'll step in here. To ask you, Chris, do you have any metallic things on above your waist?
No.
Necklaces?
I left my
like
necklace
that?
at home. I'm smart.
Okay, excellent, excellent. Well, we're going to be taking a couple of shots of you. If you'd step this direction towards the board. Facing the board, please. All right. I have my cassette in here. Landscape, to be able to get the breadth of your wide barrel shaped chest here. Okay, what I'm going to have you do is step as close as you can to the board. Okay, going to collimate the light field, so it is about 2 inches or 1.5 inches above your shoulders. Center your to the base of your scapula. Now I'm going to have you roll your shoulders forward to get the scapula out of the lung field, and can you place your hands palm size out on your hips? Excellent. Okay. Going to put some shielding behind you. Alright, looks good. I'm going to shoot Chris at about, let's see, 110 at 4 mass. Okay, Chris, can you take a deep breath in and hold it? Exposure, and breathe, and relax. Okay, the next shot we're going to be taking, I'm going to have you face that wall.
That one?
Yes, that one, with your... Okay. I'm going to put this cassette in portrait-wise. Now, Chris, I'm going to have you, are you able to put your hands above your head and hold your elbows as such? Excellent. And your shoulder against there. Can you take a half a step forward, please? Going to collimate to the portrait-sized cassette. Can you take another half step forward? Thank you. The center, down the mid-coronal plane. Okay, excellent. Move the shield back into place. And use an exposure of about 110 kVp at 8 max. Okay, Chris, I'd like you to take a deep breath in and hold it, please. Exposure, and breathe and relax. And by doing this technique, I should have included the entire lung field's apices to consophrenic angles. Got no rotation in the spine, and the ribs are all superimposed. Okay, Mr. Stater, can you verify your full name and date of birth?
Chris Stater, 6/25/66.
And what brings you in for x-rays today, Mr. Stater?
My knee.
Oh, your knee. Which knee is the affected
The
one?
right one here.
Oh, your right knee. And what happened with your right knee?
Well, back in I was running through the jungle. Your grenade from Charlie go off. Hit the deck. Hit a branch. Broke it.
Oh, okay. So have you had surgery on this knee prior to this?
Yeah, back in the mobile hospital, they kind of repaired it, but didn't do the best job.
Okay. Would any prior X-rays show up? Possibly.
They're on film.
Okay. Have you had any recent X-rays on your knee?
No.
Okay. Well, we are going to be taking a 5 different views of your knee.
Okay.
So I'm going to have you sit down on the table over here with your head on the pillow.
Over there?
Over here. All right. I have previously aligned my tube with my bucky, and we are set at 40 inches. And Mr. Skater, I'm going to put this lead apron over you.
Enough camo?
No, just pink today, sir. Sorry. And we are taking x-rays of your right knee, correct?
Yes, that's correct.
Okay, excellent. Well, I'm going to pull your shorts up from right there. Center the central ray, 1/2 inch below the patella apex. I will put the marker on the lateral side, and I will take this x-ray. Yes, sir, can you point your toe up and keep this knee as straight as possible? And my technique that I will use for this view of the knee will be 66 kV at 6 mass. And I will proceed to take the x-ray. All right, Mr. Stater, for this next view, if I can have you slightly roll onto your left hip and bring this knee over a bit. Try to keep it as straight as possible. Excellent.
See, that's the position that hurts. Well, it's going to take long?
We're moving as fast as we can, sir.
I appreciate it. You remind me of the lieutenant I had.
Oh, really?
Yep, Lieutenant Dan.
Lieutenant Dan, huh? Okay, we have centered once again at the base of patella, 1/2 inch below it. At roughly 40-45 degrees, medially rotated. And I will keep the same technique as I used before. I will shoot the x-ray. Alright, Mr. Stater, for this view, I would like you to roll your left hip over this direction and place your left leg on the other side of your right.
This thing's still going? This.
Yes.
Oh. That's the
Make sure to keep the femoral condyles on a parallel plane with the IR as to so they will show superimposed in the image. Marker down and proceed to take the X-ray. Alright, Mr. Stater, you can get back on your roll over back onto your back.
Thank you.
Okay, Mr. Stater, for this X-ray, I'm going to have you place your right leg, angle it slightly, bend it. Okay, just a bit less. There you go. Okay, for my tunnel view, I'm going to angle the collimator so it is parallel with his tib fib. And in order to illustrate the intercondylar fossa, okay, I will realign the bucky to accommodate the angulation of the beam. And shoot the X-ray. Alright, Mr. Stater, for this final shot, if you can scoop yourself down towards the edge of the table here. Right, Mr. Stater. Okay, actually, if you could just hold that right there, that's gonna work. I just got that since it looks as if you've lost your pillow.
Yeah, it fell again. Damn, totally. And mine, they never felt like that.
Bring your knee up just a slight bit more. Marker in place. And I would change my technique to roughly roughly 62 at 4. Proceed to take the X-ray. All right, Mr. Sager, it looks like you're all done.
All done?
I'm going to take a look at all of these images and see if we have diagnostically sound X-rays. Okay, I will now select the proper patient. Scan set. Check to see that my numbers correlate for the proper shot. Insert the blade into the reader. And critique the image.